Apicha CHC reveals health wellness needs of LGBTQ Asian and Pacific Islanders in New York City. Apicha Community Health Center has released a groundbreaking report addressing the health and wellness needs of LGBTQ Asian, Asian American, South Asian, Southeast Asian, and Pacific Islander communities in New York City. The year-long study explored various aspects, including health needs, barriers to access, and recommended programs. Key recommendations include expanding mental health services, increasing awareness about free STD, HIV testing, offering dermatology services, and providing culturally competent healthcare providers. The study involved surveys, discussions, focus groups, and interviews with LGBTQ API individuals and professionals. Apicha CHC aims to develop programs at its new center in Jackson Heights, Queens, based on the report findings.
My name is Glenn Magpantay. I'm the principal investigator for Apicha study on the health and wellness needs of the South Asian, Asian American community in the greater New York City area. The needs of LGBTQ South Asians and Desis across New York City, Bangladeshis, Indians, Pakistanis, Guyanese, Sri Lankans, Nepalese are often overlooked. And we're so happy to work with Apicha to find what the needs are of the LGBTQ Desi community in New York to address issues around culturally competent care, mental health, HIV/AIDS, and primary care services.
My name is Therese Rodriguez, CEO of Apicha. Given the importance of mental health in our community, one thing that we found in our survey is that the parents of the LGBT are not given the attention that they should be given. When we are dealing with mental health, the family should be part of the healing process, of the taking care of each other. And so this study points us in the direction of not only dealing with the medical needs, but as well the mental health and social needs of our community.
Good morning. My name is Melanie Dulfo. I am the Director of Community Health Education at Apicha Community Health Center. And we are delighted that even as we see the findings from this study, we see that we are able to address these findings already as we already provide some of the services that the needs indicate. For instance, we do have mental health as part of primary care at our Community Health Center. And we also provide free HIV and STI testing at the Community Health Center.
नमस्ते, मेरा नाम देविका पटेल है और मैं यहाँ एपिचा में पिछले 14 सालों से काम कर रही हूँ। आज हमने एक स्टडी रिलीज़ किया है जो कि एशियन और साउथ एशियन LGBTQ और कई सारी कम्युनिटी के नीड्स यानी कि कैसी ज़रूरियातों है उसके आधार पर स्टडी हमने किया है पिछले 1.5 साल से, तो उसका हमने रिलीज़ किया है। यहाँ एपिचा में हम सभी सेवाएं, सभी सर्विसेज देते हैं किसी भी समुदाय के, आप चाहे इंडियन हो, नेपाली हो, सभी लैंग्वेजेस में हम सेवा देते हैं। प्राइमरी केयर, आप को डॉक्टर की ज़रूरत है या तो फिर आपके बच्चों को डॉक्टर की ज़रूरत है, मेंटल हेल्थ सर्विसेज, हेल्थ एजुकेशन सर्विसेज, क्लासेस, वी डू ऑल ऑफ देम। इफ़ यू डोंट हैव इंश्योरेंस, आपके पास इंश्योरेंस नहीं है तो हम उनको भी हेल्प करते हैं। तो आप यहाँ पे ज़रूर पे कांटेक्ट कीजिए और हमारा नंबर है 646-744-2589 और आप चाहे तो कॉल कर सकते हैं हमारे जैक्सन हाइट यानी कि क्वींस लोकेशन पे। उसका नंबर है 718-567-5200। थैंक यू, धन्यवाद।
If anybody don't have insurance or insurance will not cover, then will you help us with them?
हाँ, तो आप किसी को भी पास इंश्योरेंस नहीं है तो हम आपको इंश्योरेंस में एनरोलमेंट की हेल्प कर सकते हैं, या तो फिर हमारे पास ऐसी स्केलिंग सिस्टम है जिसके पास हम आपको कम दाम में आपको सेवाएं दे सकते हैं, लेकिन ज़्यादातर हमको इंश्योरेंस में ही हेल्प करते हैं। आप आपके पास इंश्योरेंस नहीं है तब भी हम आपको देख सकते हैं, तो इसकी कोई दिक्कत नहीं है। अभी तो सिर्फ 2 जगह पे है, एक तो मैनहट्टन में है, चाइना टाउन में, जो कि हमारा प्राइमरी लोकेशन है, और अभी हमने 1.5 साल से यहाँ पे क्वींस में जैक्सन हाइट में दिया हुआ है, और यहाँ पे हमने एक्सपांड की है सर्विसेज। यहाँ पे हम प्राइमरी केयर अडल्ट के लिए, पीडियाट्रिशियंस, मेंटल हेल्थ सर्विसेज, थेरापिस्ट और डेंटल भी चालू किया है, जो कि सभी को, यानी कि अडल्ट और पीडियाट्रिक दोनों पेशेंट्स को देखते हैं। तो आपको मैनहट्टन में अगर आपको डॉक्टर देखना है तो आप हमारे क्लिनिक में कॉल कर सकते हैं 212-334-6029। अगर आपको क्वींस में हमारे लोकेशन को कोई भी सर्विसेज चाहिए तो आप कॉल कर सकते हैं 718-567-5200। एम्बुलेंस अभी तो हमारे पास नहीं है, लेकिन हमारे पास केस मैनेजमेंट सर्विसेज है, यानी कि कोई भी आपको ट्रांसपोर्टेशन की दिक्कत हो तो वो आपको असिस्ट करते हैं। अगर किसी के पास सबवे लेने की इनकम ना हो तो उनको भी हम हमारे केस वर्कर्स हेल्प कर सकते हैं, तो वो सपोर्ट सर्विसेज के द्वारा हम प्रदान करते हैं।
Good morning. My name is Venus Vajrakitja. I'm a Senior Director of Support Services here at Apicha. I take care of both locations in Manhattan and in Jackson Heights. We are open at the Jackson Heights site. The majority of services we provide is for those who are in need or individuals who are underserved. We focusing on immigrants, API, and LGBTQ+. That doesn't mean that we don't help anyone who come in our doors. Predominantly for the services that we do is if we have if the individual comes in who have difficulties paying for the services, I always tell the client, just come in and then we will help you to figure it out. We will look at you as an individual, and we will help you out in terms of reviewing what case do you have, what paperwork do you do, what do you have at all, and then we will figure it out. I want to say one thing that the service we provide, we look at the person as a person. We here is a safe space for anyone that comes into the door. Regardless of their race, ethnicity, immigration status, it doesn't matter. Apicha is here to service that person. That's it.
How to reach here, subway, bus, or how to come to this point?
Okay.
Or Chinatown. Please explain.
Okay.
Layman can understand all that.
Sure. So let's say you want to go to Manhattan site, and we are at the border of Chinatown and Tribeca. You can take a lot of train goes there. So the NRQ ACEs go to Canal Street. Then once you get off, we are 1 block below Canal. So we're at the corner of Broadway and Walker Street. If you want to come here to the Queens site, which are the closest one will be on a 7 line. I personally take the E line to come here. I will get off on Jackson Heights, Roosevelt, and then just walk a few blocks to 82nd Street. It's really close by.
My name is Sunita Ariel. I'm a pediatrician. I started working here at Jackson Heights office with Apicha. So I do speak different languages, Nepali, Bengali, Hindi, Urdu, and I do see kids. It's very helpful learning, talking to them in their language, especially for the immigrants. I talk to them about the vaccination and how to keep all these kids healthy. And there are some kids, they are LGBT, trans. We also talk to these kids about this because when they are new to this country, they get lost. They have no clue where to go, what to do. So Jackson Heights office has been helping all these kids, and it's my pleasure working with all these kids and all the team here. Thank you. I feel I love kids, so that's why I'm a pediatrician. I do have 15 plus years experience, so it feels so good because they have a lot of different questions and very challenging questions also. I feel very good, treating all these kids. So I do get a lot of new immigrants from different countries, Spanish speaking, and also Southeast Asian. They're first, when they come here, all the parents, they're worried about their kids' health. So they know a lot about vaccines, but it's not like, as back home and here is different. So I educate them what vaccines they are getting, and also they get into school systems, so how to get, preparing their physical forms to go there, and then the continuity of care, which is not, they have that experience. It's not you have to go to doctors only you are sick, but you have to go to doctors regularly to keep your kids healthy. So those are the important thing we give them message. Okay, so it's the social environment and also food and eating habits. It's a lot different from their country to here, but coming to New York, they're lucky. They can find all of their kind of food or varieties of food. Initially, it's a little difficult for them, but later they adopt and they're eating more American food than their own food. But we always talk about eating healthy, what American or Asian or Hispanic, but it's a preparation method, the spices and all those things, but we always talk about healthy eating. We do not stick to one type, but we recommend fruits, vegetables, and then more healthy diet.